Hello, I'm Dr. Elizabeth Coyne, and I'm going to present Managing Complex Clients for you this trimester. Now, this is a course which has got a real aspect to help you think about the depth of your clients and how to sort of look at those critical incidences, be aware of situational awareness, and what are the influencing factors. So particularly after completing this course, you should be able to apply critical thinking and problem solving skills to design a comprehensive situational awareness assessment for complex clients. So this is actually part of one of the assessment items where you actually make your own situational awareness flowchart. You should be able to interpret evidence to identify and manage deteriorating clients and to support their families, and to look and really appraise transitional care of complex clients as they move between different areas or between different stages in treatment, and apply this advanced knowledge and judgment to manage ethical and legal issues in high-risk situations and promote best health outcomes for your clients and also their families. So if you're new to Griffith and the master's programs, or if you've come through our bachelor, you may have some idea on how to navigate our courses, but it's really important to spend about half an hour actually working your way through the course. So I'm your course convener and teacher, and I'm sort of the person to have that main contact with you over the trimester. It's really important to check the study chart for the assessment date and also the different team sessions. They will be recorded, but it's also a great idea to bring your questions to those. Make sure you understand the course profile. Look at just the different aspects of assessments to make sure that you understand your rights as a student, and how you actually navigate if you fall sick or anything during the trimester. Read over and save the 3 assessment items to make sure that you are actually focusing your sort of module information to go and line up with your different assessment items. And review the courses you are doing and think about your workload. And remember to check census date. So if you've enrolled in 4 courses and then life starts to happen around you, this is the time to actually really make sure that you think, okay, maybe I need to drop some courses now. Be aware of navigating the course. So I've highlighted there the key sections. So every week there will be an announcement, and this will highlight where you should be in the course, but also key aspects like assessment due, and also when we're having Teams meetings. Remember to look at the course profile and the modules. So the modules have all been updated over the last 2 years, and also the reading list, which will be updated. This is a good spot to start for your assessment items. Be aware of the health writing and reading guidelines so that you're remembering to reference correctly, and also to sort of think about sort of how you actually make sure you're using academic writing. Your marks, also important, looking at that for your assessment due dates and drafts and things. So your assessment overview and your teaching staff are 2 aspects there as well. Assessment 1 is a poster of a transitional complex care. And this is really important to think about what you're going to present, and what a transitional aspect of complex care. So depending on where you're working, this may be moving patients from a ward to theatre and to back, or in emergency if you're moving patients around from emergency to a ward area, or it may be a transition in their care from, taking some high, in oncology, changing of medications in a ward area. If you're in aged care and doing your master's, this may be a transition from your aged care facility to hospital, or from hospital to aged care, or as a new admission in any area. So remembering to think about what your complex care is. And then sort of you're making a poster, A3 size, which is a flow chart. So basically use a PowerPoint presentation, put in the aspects, remembering to think about the size of your font, that it reads well. As you're looking there, you also write a report, which is 1,300 words. And so remembering to introduce your flowchart and client group, justify the complexity, and then look at the assessment and management approaches, particularly in the inclusion of family and thinking about also that interdisciplinary team. And then conclude. So this is only 25% of your marks, but it's a nice, easy way to start to build marks in this course. So this is an example of some posters. So this is, it's stroke patients admission via home or GP. And so this is where it can be a complex situation that aligns with where you're working. And there are exemplars in the course assessment side. And this is another one that's looking at sort of the transfer of patients. And you can see that different aspects to think about. Does it read well? Is the font clear? Does it have a flow rate? So these are all things to think about as you're presenting yours, because they're worth marks in the assessment item. Assessment item 2 is management of the complex client. So this is a slightly longer assignment, but not too much at 1,500 words. And this is where you're discussing the management of a complex client who's at risk of deterioration. And so you might sort of think of, an older patient going to theatre. You may have a child if you're working in a pediatric area. And so you're looking here at the situational awareness. So you want to sort of have this summary of your chosen client, highlighting their risk of deterioration and detailing issues so that create complexity. So if you're thinking of, say, a pediatric assessment and deterioration, it may be that sort of need of the parents for that additional information. It may be a complexity of the situation where you've got a lot of staff looking after one patient in an emergency transition of staff. And so this is where you can actually then write this great summary about your chosen patient, critique these situational awareness issues with literature. So thinking about sort of, is it staffing levels? If it's staffing, movement, is it the other outside external factors which are going to influence this patient's risk of deterioration? And then design a nursing management plan. So these are great assignments to really improve your own clinical practice as you're moving through this unit. And the last one, we have some coroner's cases. So you basically choose one that works for you, and then you're demonstrating your critical evaluation of patient deterioration that ended in death. This is actually a really good assignment for students to actually think about what could have happened, and so what has happened in these coroner's cases. And so this is, again, look at your evidence. You need to critically evaluate the case study. We don't need a description of it. We want a critical evaluation of the situational factors so that, this may be that it's been transferred without time for adequate handover, cause some of the factors. It's often when you look at these coroner's cases, it's like that Swiss cheese effect, where if there'd only been one or two factors, there may not have been an issue. But with numerous factors, then this becomes leading towards complexity. And then in the end result, these patients have passed away. So looking at then recommendations to improvement related to the trigger points that you identified. So this is an assignment where you've really got to think about, okay, what are the points I'm going to identify and what recommendations with, again, the supporting literature. So remember, just to sum up, that the online tutorials will be around each assessment item. So make sure you come prepared with some points. There's going to be mini lectures that I'm doing for each assessment item just to go through exactly what's needed. Answering of common questions can be as emails or within our Teams site. Remote word count is exact now with the new rules of assessment items. So make sure that you don't sort of be under or over. Requests for extension need to be submitted correctly. So make sure you've got the right submission. You're not asking for a deferment, you're asking for an extension. Make sure you've got your evidence as added in there as well. And email me if any questions. Thank you.